I think the state government has come in and trying to deal with the situation. I am concerned about how much time it's taken for the state government to get on top of this outbreak on the Northwest Hospital. I'm very concerned for those Tasmanians that are still living in lockdown in Northwest Tasmania because this is taking such a long time to get a handle on. We heard from the Chief Medical Officer yesterday, of course, that he is of the view that this all started with the Ruby Princess, the one boat that should have been stopped by the government and wasn't. And we know that the first patient taken to that Northwest Hospital was off the Ruby Princess.
If we turn to the situation for senior Australians in particular, they've been really quite having a hard time with dealing with the coronavirus pandemic. Limitations on visiting people in aged care homes has been hitting many hard, but at the same time they do need to balance the fact that they're very vulnerable, and we have seen a number of devastating clusters in aged care homes in Australia.
We've seen it in Australia with two major outbreaks, one at the Dorothy Henderson Lodge and one at the Newmarch facility, both in New South Wales. But we've also seen some of the devastation from overseas, where 30 to 40% of total deaths have occurred in nursing homes. We know this is a very serious issue, and I can understand and certainly have a lot of empathy for families and loved ones who want to visit their relatives in residential aged care. I also have a bit of empathy for some of the providers, but particularly the staff who are doing everything they can. There's some of, low-paid workers in Australia on the front line every day doing their very, very best without enough staff and without enough resources to be able to do what they need to do. And I think that the aged care workers are doing a phenomenal job in very trying circumstances. We also know that access to protective equipment is an issue for some of those workers in some of the facilities. And we also know that there are some supports that government could be providing and should be providing, and it's taking government quite some time to react. We know with Newmarch House that outbreak there has been a week. We know that the staffing levels are not where they should be. We've had the owner Anglicare say that publicly yesterday. The government's intervention and the surge workforce that I have been raising concerns with the government about for weeks and weeks has taken over a week to turn up at Newmarch House to be able to get up to adequate staffing levels to care for those residents in that facility.
There has been some confusion too about whether people can visit their elderly friends and relatives in aged care homes. The Prime Minister said that he does want to clarify that, but it is a delicate balance in making sure that the needs of each individual home is balanced with the care for the elderly.
Absolutely, Annalise. It's also, one of these areas where there's a lot of confusion at the moment between the Commonwealth and the states. We have some states saying, yes, it's fine. We have other states where they're saying no visitors whatsoever. So we have a bit of a differentiation between some states and the Commonwealth in this regard, and it's adding a lot of confusion for families who really want to be able to have contact with their loved ones. My advice to the family members is please talk to your providers. The providers are doing everything they can. They're taking into account personal situations. They're taking into account the situation within their own facility and trying to do their very best to give people access as quickly as possible into some of these facilities. We know that everybody wants to be able to visit their loved one as quickly as possible, but we also need to make sure that we're protecting the mental and the physical well-being of these residents in light of what we've seen where, one person going into a facility today in one facility has infected 44 other people. We cannot have visitors going in and out willy-nilly who may be infected with COVID, spreading it throughout facilities, and that is the real fear, I think, of providers.